And thank you for your report and the evidence-based action, you know, for the Act to Travel the Magic Pill. I'm going to just start as well with you, Owen, as well, that it is shocking that, you know, a third of deaths are alcohol, or fatalities are alcohol related, but then over a third of people that are arrested, that they're not getting convictions. Like, is that down to, I suppose, I want your opinion maybe on this, is that down to post-sampling, what we spoke about? Is it something, like, that's a huge amount of people that are getting away with it, basically. And I suppose, could you just talk a bit more about that?
I mean, like we've said, part of resources is the key, okay?
Yeah.
But then it's also the challenges around getting the sample in the big bad accidents. So guard resources will be the key initially to have the high visibility enforcement on our roads. You know, we are the worst country in Europe, like we said, and we're only going to get worse if that trajectory continues. Our road deaths are going up, the rest of the world is going down. So guard resourcing, number one. And then there's legislative change needed to mimic what's happening in other jurisdictions with lower death rates. So, for instance, in the UK, they have what's defined as an unlimited, they have a reasonable time frame to get the sample.
Yeah.
Now, that can mean an hour or two, or that can mean 7 or 8 hours or plus. And we've seen examples of this previously in the UK where people have been convicted hours and hours after the 3-hour limit that we would have had here. It's not practical a lot of the time to, I mean, unless somebody actually witnesses the accident and is looking at their watch to say that accident happened at 2:34 a.m. So the initial things, and I presented this previously at the AGSI conference, and the Gardaí voted in favour of extending the time frame they have to get the sample. That would make a big difference for the big bad accident that ends up in hospital.
And that
but
will
most
come in
don't.
the court. That will
Yeah.
come in then when the proceedings go through. That it's,
Yeah.
you know, that's going to impact. Yeah, could you?
Just on that, Senator, we've called for an investigation into the low levels of convictions. When we look at England and Wales, we see conviction rates in the 90s. For Ireland, conviction rates are in the low 60s. So we can't put our finger on what the issues quite are, but we think that, you know, there is a necessity for that to be investigated.
Thank you, Anna. And I just might go on to here and to yourselves, and thank you very much, because I would completely agree that there does need to be a commissioner, because like you said in your opening statement, Caoimhe, that, you know, the transport issue is not only it's a health issue, it's a climate issue, it's an education issue. In policy, you said transport policy, and I would completely agree with you that, like, bad design is causing a lot. And I suppose I'd like to talk a bit more about that, maybe about, like, why we don't have mandatory 30 kilometres in urban settings. Why do we have, like, and I live in a rural constituency, why there's not availability of additional public transport? Why do we have electric buses that have no batteries stuck in storage? Like, you could go on and on and on about the flaws within the availability of alternative public transport, and about enforcement of, like, and the reluctance to actually say speed does kill, and the size of SUVs, like the impact that they have in comparison to standard cars. So I suppose I'd just love to get a bit more information about that.
And I suppose I agree with all of those points, and that would be our opinion as well. We would share that. I think what it comes back to from the health perspective is we're looking at the built and the natural environment around us. You know, the health consequences is not an individual choice because people are physically inactive in Ireland. It's because it's by design. You know, we don't have the safe roads, we don't have the segregated cycle paths, we don't have the wide, comfortable footpaths. And I think what we're going to see is, well, at the moment, what we know is we have 1 in 4 children who cannot run properly, 1 in 4 children who are living with overweight or obesity, 1 in 6 adults are not physically active enough. We have a really high number of individuals nationally every year getting a diagnosis of diabetes, 8,793. We're spending 10% of the health service money treating diabetes. Diabetes is complex. It's not a multi-system disease. We're ahead of EU and global averages on that. And it's all because of the sedentary lifestyle associated. Again, this is not to do with individual blame of people. It is the transport facilities and network around us all, and we're not able to be physically active to access it safely.
Yeah, thank you for that.
You just mentioned SUVs as well, and it is important to mention that if you're struck by an SUV as a pedestrian or cyclist, you're 44% more likely to be killed.
How much?
44% more likely. Okay, so that was a study that came out last year. Children are 82% more likely to be killed, and it's because of their size. They're taller, the heavier, the wider. So when you get struck by the by the SUV, you get struck in the chest or the pelvis as opposed to the shins.
Yet it's been the same, it's treated like standard cars. I mean, they're in relation to speed and
of course.
30 kilometres.
But then once you get struck, you get knocked off in front of it, and it can roll over you as well, so you get struck twice. Now look, 20% of collisions in Europe involved in SUV. If we were to remove SUVs from the roads, our mortality rate would drop by about 8%. Now, about 8. Yeah. Now look, it's a consumer choice, it's personal choice. That's fine. If we're going to let people drive these vehicles, we need to also create a safe infrastructure for everyone else to use the roads as well.
Yeah, road sharing the space. Of
Absolutely,
roads,
but that comes down to
yeah.
proper segregated design. That has to happen.
And what about the impact of, I suppose, the reluctance of the government to roll back on the 30-kilometre zones in urban areas?
I don't understand it. It was ready to go, and it would have made a huge difference. It would have saved lives. But
that it would be across the board, that it would be mandatory within built-up urban areas.
Within built-up urban areas where people live, work, and socialise, 30 kilometres per hour would have been mandatory. It was rolled back. I don't understand the ins and outs of why it was. So.
I'm going to just jump in there. There's so much evidence out there showing that 30-kilometre speed limit zones work. They've done it in multiple European countries, Amsterdam, Barcelona, Wales. It's everywhere in the UK, and they know it's effective. We have evidence. It is saving lives, and I think it's a real missed opportunity for health.
And that comes down to enforcement, I suppose, again, that even if the signage is there and even if there, that there's just not enough cameras on the road and there's not, so again, it's in road policing.
It is road policing, but it is also design.
Yeah.
I mean, there's lots of structural things. I'm not an engineer, but, there's modal... how do you call them, John? Modal filters, and there's the gentle paving. If you go to any of some of the towns in the Netherlands, there's it's even some of the stuff that they're doing out there is really good. I live in Dublin. Like there's the plant boxes. There's you make narrow streets to slow cars down.
But it actually makes the place you live nicer.
Yeah.
As well. But the results from 40 European cities that have done this as well is 23% fewer collisions, 37% fewer fatalities, 38% fewer injuries, reduced noise pollution as well, and 7% less fuel consumption. And the impact on your journey time, negligible, about 3%, 3 to 5%.
Thank you.